Welcome, everybody. I'm Scott Greer, and I'd like to thank you for coming out in this beautiful weather for what promises to be a really good talk. I'm stepping in as introducer for CES Director Carla Mallet, who has to be out of town, and I'm introducing today's visitor, Saima Özkurumes. Saima's going to be speaking on a topic that could hardly be more timely. As you know, the refugee crisis in the Mediterranean and its health implications is an issue that brings together many of the biggest crises of the day and also many of the biggest preoccupations of the age, such as war, mass migration, sectarianism. The topic's exciting enough, I don't think I need to sell you, so instead I'll tell you to get excited about our speaker, and then I'll be off stage. Saima received her PhD from McGill in Canada and is an assistant professor in the Department of Political Science and Public Administration at Bilkent University in Ankara in Turkey. She's currently visiting at Harvard, which has good taste. She conducts research and publishes on migration policy and politics in the European Union, Turkey, and Canada, health and immigration, gender and immigration, irregular immigration, integration and citizenship, media representation of migrants, comparative politics of deliberative democracy, and the Europeanization of the above. She's articles in journals including the Journal of Balkan and Near Eastern Studies, Comparative Politics, the Journal of Common Market Studies, European Political Science, International Relations, and some journals in Turkish. She's also the co-editor of 2 books, of States' Rights and Social Closure with Palgrave, and Asylum, International Migration, and Statelessness, which I got really excited until I realized it's in Turkish. She's been part of many international and national collaborative research projects on topics including cultural diversity and healthcare systems, transcultural memory in Europe, the transformation of governance in Turkey in relation to European Union accession, and she's the co-principal investigator of the Mobility Lab at Bilkent University, which conducts research and activities on public policy co-construction, as well as collaboration focused on immigration and integration policy, so nothing timely or relevant. Her talk today is going to come from a project on the resilience of healthcare systems in Turkey, Jordan, Lebanon, and Lebanon in response to the mass influx of refugees from the catastrophe in Syria. She's come to us thanks to the generosity of 2 University of Michigan partners, the Weiser Center for Emerging Democracies, and the School of Public Health's Office of Global Public Health Policy, and the hard work of the long-suffering Zana Quaiser in the back of the room. I'd like to thank them all very much. Then, I'd like you to all welcome Saima and hold your questions until she takes them at the end.
Thank you so much, Scott, for this kind introduction. I hope I'll be able to live up to it. And yes, I'm here in the States this year for my research on Syrian refugees received by Turkey, Jordan, and Lebanon, and the healthcare response to them. But today here I'm going to talk to you about comparing this experience with that of Europe. And it's very timely because the experience has been putting Europe to a test. And I'm not going to be the first one to tell you that Europe as a whole and different countries receiving Syrians in Europe are in trouble. And there are various reasons for that, but the story I'll share with you has a different dimension. And in terms of particularly theoretically analyzing what we're going through empirically, particularly in the beginning of 2015 and afterwards, although the movement dates back and also the Syrian crisis itself dates back. So the way I structured my presentation for today is I'm going to a little bit talk to you about the context and why there is this much talk about a crisis in Europe and the refugee crisis, but I tried to name it not the refugee crisis but the mobility crisis. And the reason for that is there are various ways of approaching the movements of peoples, and one of the issues with respect to why there is experience that is different from the past in Europe is that this mobility is different in different ways. And that makes a difference in terms of how healthcare policy responses are different as well. So I'm going to share with you my research question, the conceptual frameworks actually, the early findings that I have on this particular question, and then a few preliminary conclusions in the light of what has been going on. Let me set up a little bit the context for us all. Most of you in the room are familiar with public health, most of you are familiar with WHO and so on, and also the initiatives that concern migrants and health. But what is very exciting is also in 2015, the fall of 2015, there has been increased debate about how to address in Europe as a region the movement that had been taking place from the Middle East and mainly from Syria. And what attracted my attention dimension in terms of the high-level meetings and different reports that had been prepared is the kind of response that has been given in terms of how prepared Europe was and what it needs to address in terms of the new movement that was taking place in its own direction. Now, as you see here, I will not read the whole part, but the ones that I have highlighted seem to be important for what I'm trying to observe here. But we as a region must seek to ensure that all countries are adequately prepared and organized to withstand the added pressures of supporting a mass influx of people, while at the same time protecting the health of their resident populations. A good response to the challenges of people on the move requires health system preparedness and capacity, including robust epidemiological data and migration intelligence, careful planning, training, and above all, adherence to the principles of equity, solidarity, and human rights. So Europe as a region preparing, and this is not the European Union, but Europe as a region, and I'll tell that in a moment, because there might be debate about whether Turkey is in Europe or not, but for the purposes of this presentation, I'll consider it to be a part of Europe, because lately it has become, in fact, central to the debates on what's been going on with respect to responses of public policy to the movement of people. But I was also curious about the preparedness and capacity in this particular aspect of healthcare policies to the influx of peoples. Now, when we look at this dimension, meaning Europe and its response and preparedness, and when we look at it from the dimension of Turkey, I would like to share a quote with you that in fact struck me well in terms of what has been going on in Turkey in response to the crises that had been taking place. This is no other person than Guterres from the UNHCR, who quoted Turkey as acting as an example in terms of managing well the movement that was taking place, and that Turkey's policy was correct. Now, my puzzle was, Europe is trying to prepare itself in 2015 to what's going on, and then Turkey's policy of the past 5 years, and when this was done, it was about 4.5 years that the conflict was taking place and people more moving inside, as a policy that was correct. So now we need to think about how Europe responds to the different movements of people, and how also Turkey responds, and whether they have anything to learn from each other in terms of the policy response and the dimensions that it has taken. Now let's see what has been going on in the past year. And the data that I'll share with you is from Eurostat. And this actually is the crisis, meaning the numbers are in fact increasing at unprecedented levels in terms of what Europe has been experiencing. Another issue here is who's coming in. Now, before, the discussion was different nationalities had been seeking asylum in Europe and also in Turkey. But again, in the last 2 years, this has been overwhelmingly a Syrian population. So the presentation will be mostly about in response to the immediate crisis that had been taking place. Another issue is who is receiving, or which countries are receiving these populations. Now, in this presentation, I'm familiar with the cases of Germany and Italy because of the previous publications that Scott has shared with you, and their experience in terms of diversity in their healthcare systems. So those two were, in fact, out there, but they were also very significant with respect to the discussions that have taken place in the past few years in terms of the initiatives that have been taken by a particular country, Germany, right? And then 2 other countries came to the forefront, which were Italy and Greece, because of the pressures of the movements that were taking place. Now, one word of caution here is Italy and Greece have been experiencing movement towards their borders before as well. So what has changed, and that's because of the research I have done on irregular migration, but what has changed is, of course, the nature and magnitude of the influx that's taking place now, and the kinds of people that are arriving with asylum applications at the borders as well. Now, the other issue that we have here with respect to the context that we're discussing is how many are arriving, and whether this really makes a difference in relation to the percentage of total population. Because those of us who study diversity also pay attention to the kind of diversity that is going to change the population, the composition of the population, the demands on the different public policies, and so on. So no surprise here that if we look at the World Bank, UNHCR, and Eurostat data on the number of people that are arriving, overwhelmingly Turkey is hosting a large number of people that are arriving in the past 5 years, of course, but also which are increasing in the past 2 years as well. Now, in contrast to the others, the European dimension of the story, Italy, Greece, and Germany, this number looks, in fact, huge. So the puzzle is, Europe is being prepared for a number, a group, that actually is not matching the number that Turkey has been receiving and has been, in fact, helping with respect to policies. So what's going on here? To just put into a little bit perspective in terms of what Turkey has been experiencing in contrast to what has been transpiring since last summer and last fall in Europe, I'd like to point out the numbers. In April 2011, around 200 plus people walk through the borders between Turkey and Syria. And now different sources are quoting around 2.6 million, 2.7 million present in the country. In terms of health policy, what happened is, once these people started walking in, the emergency care was provided for them, for the wounded, particularly received at the border. The healthcare services were provided in camps. So in contrast to most European countries, Turkey has camps installed in, particularly on the southeastern border region, and also secondary and tertiary hospital care was provided. Now, if we only took these three important services that were provided at the beginning and think about the kind of scale that the country was experiencing in the 5 years with respect to the jump to 2.6 million, we actually seem to have a puzzle with respect to a healthcare policy response that seems to hold itself together. What happened in between are two major legal framework changes. One is Turkey in April 2011 did not have a law for immigration and asylum. Yes, that's true. But as of April 2013, it has a law on foreigners and international protection. And when Turkey started receiving these individuals, these groups that are in large numbers, also it did not have a legal framework that would in fact address specifically this group of people. But now it also has one, which is called the Temporary Protection Directive, which is specifically directed at the services which will be provided to the Syrians, including healthcare access. So we have these two pictures. I put here the puzzle, but I also thought, should I put the model question mark, the best practice question mark? But I still have a question mark about that after 5 years, so I didn't put that, so I put this as a puzzle. So what is the research question out here that we're trying to understand? How do different states respond to refugees in their healthcare systems in Europe? And the parenthesis is the why, because in this presentation, I will a little bit challenge the kind of why responses given in the literature, as opposed to the ones that I'll propose, which come from actually studying particularly the case of Turkey and trying to explain a disaster management perspective, as opposed to a healthcare response perspective in a regular period of time when the demand would increase by particularly nationals or incoming people. As I said, the cases, as I have just presented to you, will be Germany, which is receiving lately large numbers of these individuals, Italy and Greece because of experiencing the pressure, and Turkey, which actually has the numbers that are large. And the data is about the migration policy index indicators that have been put forward now, and I tried to focus on data that was comparatively available, and it's very hard to find, in the sense that data that is collected is usually nationally collected, and that also has different dimensions that bring in problems about analyzing it. So I tried to find data that could be comparable, and the two international organizations, in addition to the MIPEX data that was available through a project, were the ones from the WHO and also IOM, which focus on health and diversity as well. Now, as I said, the literature has different ways of explaining what goes on in periods of challenges to public policy. But what seems to be transpiring from particularly the case of Turkey, but also from what I just quoted from WHO and the high-level meeting on what Europe would be doing with respect to the mass influx of people, is the concept of resilience. So trying to understand whether Europe is going to be able to cope with the influx and will be able to display some form of resilience in response to what's going on is a major question that's going to come forward. And another issue here is, do they have the crisis response capacity in the literature? I'm going to refrain from summarizing you the literature here, but what is very important is that the system is expected to be equipped with the kind of policy tools, human resources, and financial resources that will respond to the kind of challenge that will come. This could be as a result of a disaster, this could be as a result of an emergency, this could be as a result of a major change or transformation in terms of the demand or the supply that's going to come. But nonetheless, this is about a crisis situation. So then we need to look at these countries to see whether they have in place crisis response mechanisms, which are results of humanitarian crises. Because when we look at the literature, what we also realize that most of the disaster management or resilience literature is focusing on natural disasters and their consequences. But humanitarian crises bring about a different dimension. That is, an ongoing conflict that could actually have implications with respect to how long and the extent to which the movement will take place. The second literature that I propose to study what we have is about the transboundary crises and also administrative capacity. Now, transboundary crises and administrative capacity literature can be in fact categorized under two subheadings. One of them is the kind of executive tasks that are to be involved. So, instead of experiencing a regular public policy response, actually, in times of crises, we're experiencing a performance of executive tasks timely, in a very short period of time, and by, if I could call it that way, unusual collaboration among actors that are also not necessarily present in terms of national public policy matters, meaning international organizations, NGOs, that are part of the process in an immediate matter. So what we have here is states have a challenge. The first question is, are they prepared ex ante for the crisis at hand? So if we go back to the quote that I have selected for us, they seem to have acknowledged that they have the capacity, but are they prepared for the ex ante for the kind of crisis that's coming? Question mark. The second issue is making sense of the emerging crises. And here Europe also has a trouble. Why? Because increasingly we observe that although the Syrian crisis had started in April 2011 and the first movement then, what has been going on is gradually Europe has acknowledged that this was also a movement that was at its borders only as of last summer. So there is an issue here about making sense of the emerging crises and how to respond to that. The other issue is about managing response networks. When we look at Turkey and countries which have received massive influx of people, the response networks increasingly, and in fact over time, in different ways have been involving NGOs and international organizations. But how will Europe really relate to these actors in terms of what it is going to manage and what's going to come is also a question mark. Frame the rationale for response. We have looked at how different European countries, or the EU as a whole, in fact framed the response in very different ways. Yes, there was a humanitarian crisis, but over time, even among the countries that I've selected as cases here, but also with other countries, European nations have in fact framed the response in different ways and responded in different ways. Hungary responded very differently to the movement across its borders, and Austria responded very differently, as opposed to, say, Germany or Greece and Italy, who have been, in fact, on a daily basis adopting new policies, which I will not go into detail for. And the other issue is learning under crisis management pressures. Europe has learned the very hard way that collaboration among different states, even in the European Union, would be very difficult in response to this as a whole, and of course as in terms of the case of health policy as well. The other issue is about collaboration among actors. Which actors will be at the forefront of this matter in healthcare policy as well, interjurisdictional, intersectoral collaboration, and interagency collaboration? How will they talk to each other? Will border management have anything to do with healthcare policy management? Among domestic, cross-border, and international actors, and also preferences of strategies of different actors that unfold during this process. So what we have here, again, is what Europe is going to be experiencing or has been experiencing, but recently is trying to address with different policy innovations is going to be part of the story of managing a crisis that is now transboundary. Now, one word of caution here is when we consider this as a transboundary crisis from Turkey, we actually acknowledge or highlight the fact that this actually is happening just on the other side of the border with Turkey. What's happening with Europe is this is a transition from Turkey to the European borders through mainly Greece and then the movement across there. But it is transboundary nonetheless for another reason as well, because once these individuals arrive in Europe, they do not become a matter only for the nation states that they arrived in, but they also become a matter for the European Union because of the Dublin regulations that exist and because of the EASO that is already there, European Asylum Support Office, and because of the reason that Europe has already acknowledged that it has a Schengen area of free movement. So we have major dimensions of transboundary crisis that is unfolding as part of Europe as well. And the third literature that seems to, in fact, speak to the crisis that Europe is going through is the mobility-related challenges. So when researchers study diversity and healthcare or diversity and health system response, there had already been in place by those people who had diverse backgrounds challenges that were related to mainly the legal status of these people. Because moving people have very fluid categories, which you yourselves in the room who have done research on this might have encountered. They might be called asylum seekers, they might be called refugees, they might be called victims of human trafficking, they could be even students who are in short periods of time in a country, migrant workers, reunified family members, undocumented workers, short-term migrants, circular migrants, return migrants. So these people who are moving have different categories. Why does it matter? States relate to these people in terms of public policy provision and also healthcare provision in different ways. Right? Some are expected to pay into the system, while others are expected to be part of a humanitarian framework whereby the states feel in one way or another obliged to deliver services. And the other issue, as I said, I try to, in fact, address by looking at comparative data that is available instead of national data, is the methodological challenge. How do we find reliable data? And again, it was in the quote, migration intelligence as well as reliable data that could be compared. Now, the literature we have at hand for barriers to access in healthcare highlights several matters that seem to, in fact, figure into the healthcare policy response. One is legal status, which I just highlighted, the governance of asylum and migration, which is in the governance and asylum and migration where they fit the healthcare policy, the socioeconomic background of the people who arrive because of the socioeconomic determinants of health, language barriers, limited awareness of healthcare services, structural challenges, and group-specific challenges, which could be ethnicity-related or which could be about the timing of arrival, the staying, etc. Why is this important in the case of Syrians who are arriving in Turkey and Europe, for example? One important matter is once Turkey started to receive these individuals, the idea was about temporariness, that these people would be there for a short period of time and then they would go back. But 5 years is not a short period of time, and no one knows exactly when these people will be moving back or moving forward. So the time dimension has changed a lot too. So the group-specific dimensions also have a temporal dimension to them. Why am I telling all this story? The reason I'm telling all this story is the rest of the literature that studies diversity, which some of the works that we have done also figure into, would explain the healthcare response of different countries through 3 main variables. One is context, meaning do they provide equal rights? Do they provide opportunities for people who arrive? The second one is integration policies. Do these European countries adopt integration policies that are liberal or that are restrictive? And one is, of course, austerity measures, which in the case of Greece come forward in different ways, in more than different ways than one. Now, what I tried to do is, as I tried to find the kinds of arguments that have been produced throughout this literature, I tried to compare the MIPEX data, which has been for the past 2 years producing data on healthcare policy response as well. And they have 4 categories. Entitlements, which speak to the general literature on legal status. The second one is access policies in different countries. The third one is whether services are responsive to the group-specific needs of the individuals who arrive. And the fourth one is mechanisms for change. What I did is, while reviewing the kind of criteria that were applied in these particular indicators of how responsive healthcare systems would be, I tried to particularly isolate the ones that were for asylum seekers, based on our previous research on Italy and Germany, but also some more research on Greece and my own research on Turkey. So what came out is, for example, if we look at entitlements only for asylum seekers. Now, again, one word of conceptual caution here is that these individuals are asylum seekers until they're considered as refugees, meaning they're going to go through a process of their cases to be evaluated, to be considered as valid for refugee status, right? So we have that also dimension to how these people will be treated during that transition period as well. Now, legal entitlements and administrative barriers in these countries, wide discrepancies across countries for asylum seekers in terms of what they would provide, and the location in terms of particularly entitlements matters. Why? As I mentioned a moment ago, Turkey already has camps. But as Europe receives them, they have only reception centers or places that they settle these individuals in. So there is already the challenge, particularly from the perspective of healthcare system response, of who will provide these services. In the case of Turkey, camps have a different setup for providing services on site, but also secondary and tertiary care if these are urban refugees. Now, in different cases, when we look at the entitlements, for example, in Germany, we have legal and administrative barriers for asylum seekers, weaker entitlements for the period that they're going to be processed, and problems with documentation because these people most of the time arrive without documents, and other issues that seem to be on site. Now, increasingly, as we hear from scholars, they're not yet published, but that there are challenges in the local communities of health, particularly the kinds of sanitation issues, the kinds of issues that are related to socioeconomic determinants of health will be addressed. Now, Italy and Greece are interesting cases because they provide emergency care immediately to people who arrive. But at the same time, the systems become challenged increasingly. Why? Because of the numbers that are arriving that are huge in terms of the kind of response capacity that these systems have. Now, what does Turkey do? Turkey provides coverage that's provided to the nationals too, and also in the past 5 years has been able to provide that in an incomparably good manner, particularly in the camps. But as urban refugees increase, there are challenges that it also is experiencing. So the major issue about entitlements here is, even if countries, Germany on the one hand, not giving extremely liberal access to the system, as opposed to, say, Turkey on the other hand, Turkey, Italy, and Greece, which could be in fact grouped together, giving access immediately, have an issue about the entitlement not matching the access. So we have a challenge here in terms of introducing the legal framework without necessarily being able to promote it or implement it with access. So what do we mean by access? Is it just going and being able to have services provided because you have a registration, a card, an ID? No, it is more complicated than that. The dimensions for access is, first of all, access to information. Not only about your rights as an asylum seeker or a refugee, but also about what kind of services are available. Vaccination for your children, chronic disease care, any kind of services that you might receive with respect to your condition. Another issue is multi-language support. Are all countries prepared in terms of their healthcare facilities by multi-language support with respect to medical personnel as well as information provided? Not necessarily. Healthcare education and promotion among these people. It became an issue, for example, in the past year or so, whether there could have been education for contraceptive measures among these populations. So there is the issue of healthcare education, also in terms of hygiene and so on. While in the camps, it's a different story. But in terms of urban conditions, where people are in fact settling in large numbers, in small spaces, and not being able to access healthcare, that becomes another issue. Cultural mediators or trained patient navigators, this is also another phenomenon that we encounter in places where there has already been experience with diversity. but not the kind of diversity that is arriving at the moment. So it's a very different way of organization. For example, I'll give you the case of Germany. In the case of Germany, we experience increasingly, particularly after 2005, the introduction of multi-language support, also trained personnel and so on, and also those who are of, for example, the majority of population in Germany is Turkish, those who are of Turkish origin becoming doctors themselves, medical personnel themselves, and providing support in the system. But Syrians arriving is a very different story in terms of the available services in the system. In Italy and Greece, again, similar challenges have been there, but they have provided, on the basis of their previous experience, particularly with irregular migration, undocumented migrants who arrive, with respect to provision of support, but that is not developed extensively as well. The case of Turkey, which approached this as a crisis situation, had a very different ad hoc response. They tried to come up with policies on site with respect to having the help of those who are already present with some kind of medical information to act as interpreters, or in fact on site again trying to train personnel with respect to emergency situations too. So the countries that had already in place some policies with respect to diversity in healthcare are in a different challenge as opposed to the country that is trying to make up its policy, particularly on the basis of a reflex of disaster and emergency on the go. Another issue is about responsive services. What do we mean by responsive services? 4 criteria emerge here as well. Efforts for adaptive services. The debate here is, I'm sure some of you in the room are familiar, whether to provide migrant-specific services or in fact integrate it overall to the system. The second one is about language support, which keeps coming up with respect to its dimensions of access to information, but also bioethics dimensions of who could be in fact involved in this. Involving in service design and delivery, and national level staff preparation. Now, when we look at the 3 countries that have been experiencing this as a result of the movement that has been taking place, again, in Germany, as I said, as of 2005, there is in place some form of improvement in responsiveness on the basis of the experience of the majority Turkish population who had been diverse and who had been there for a very long time. But on the basis of providing for Syrians who are coming with different needs as well. One of them is, of course, PTSD, or if it's a refugee situation, it could be an issue of FGM as well. So the services that will be provided will have to be different. And how are they prepared for that? They're just addressing that now. In Italy and Greece, we experience another story, which is also unfolding in Germany. That is unevenness of the provision of services inside the country, which is a different case in terms of trying to understand whether we could even talk about a general European response, as opposed to nation states responding to the healthcare challenges, again, as opposed to within the state, different regions responding to healthcare challenges with respect to their own resources. So another challenge which involves levels of the provision of services depending on how the system is organized. Now, in the case of Turkey, again, there is the issue of camps versus non-camps, but also the system is organized in a way that they can access hospitals and private clinics in ways that will be able to integrate them into the system. So again, the challenge of disaster management response for healthcare policy as opposed to a system that has already been there with the experience that has been inherited from the past for Europe. The last issue is mechanisms for change. Does Europe have in place mechanisms that will prepare it for responding to the change in movement? Do they have active measures for change? Do they have research and data availability? And do they have action plans present but with rare implementation? Now, here comes the other issue. As I have quoted, and I've selected that quote purposefully, and as I have been part of the discussions on these matters that concern mechanisms for change, there do not seem to be in place immediate response mechanisms for change that will particularly address the challenges that will be put on the healthcare systems. And that's actually an important crisis that is really unfolding in the case of Europe. These 3 countries, Germany, Italy, Greece, which have in place certain healthcare policies for their own populations and for the other groups which have arrived previously, have not integrated into their systems yet a disaster management capacity that would be particularly addressing the system of healthcare response that would be increasing in terms of demand in their nation states. Now, there are and you read these accounts in the media in terms of scholars' presentations and so on, and different kinds of work that's being produced and reports, border management, how to bring these people in, who to send back to Turkey, right? Readmission agreements, the kind of amount of resources that will be exchanged and so on. But we don't necessarily hear the specific policies that will be used to address the Syrians that will be arriving, and that will be in fact part of the system. Whereas in Turkey, there has been, again because of a response to the disaster that has taken place and the humanitarian crisis, they have come up with ad hoc policies in terms of trying to address these matters with respect to the different kind of medical personnel involved and with respect to different international organizations on the ground helping Turkey deal with the situation, and also NGOs, and at times Syrians themselves who were qualified medical personnel who are involved as well. But Europe doesn't have in place at the moment these kinds of mechanisms for change or involving those on deciding about this. But this means that this is also a moment of opportunity. I'm not telling a whole story of pessimism about how unprepared Europe is for this kind of influx, but I'm telling a story of follow the next, and if you actually follow the newsletters of WHO and so on, there are series of conferences, high-level meetings that are being prepared to address this. And in fact, assessments of toolkits that are available for management. They have already published one on Greece, they have already published one on Bulgaria, so they're trying to make sure that they have in place the kind of comparative data that is going to be used in response to this. But in no time soon, this is going to be, in fact, coming out as it did in Turkey, which dealt with the situation on the ground. Now, my preliminary conclusions, which I also, in fact, divided into three about what's been going on in Europe with respect to this, based on my general overview of what's been going on at the EU level, which I didn't share in general with you, but the cases that seem to be experiencing this in fact, at higher levels than the other ones, is first of all, the legal entitlement and access matter is definitely there. Why is it there? For many different reasons. These individuals are characterized as asylum seekers. But if you have been watching what's been going on in the past 2 weeks with the negotiations with Turkey, what is unfolding is some of these people will be sent back. So their situation as undocumented, irregular, have already put them in a very different place with respect to their access to the healthcare system, as opposed to whether they will be sent back or in fact considered as refugees in the country and resettled in wherever they have arrived. So one matter is there in terms of the fluid categories that we discussed with respect to where these people are in relation to the system. The second issue is about linguistic needs. Linguistic needs don't only involve documents, interpreters, appointment times, prescription and labeling, which the reports put forward in comparative perspective, but again they also relate to the fluid categories. How much need will these countries in fact acknowledge for reaching out to these individuals, and which needs will they address? There are people from the School of Public Health here, so I will not address, whether non-communicable diseases or communicable diseases will be prioritized, whether immunization will be prioritized, whether epidemics will be, in fact, their highest priority, whether people with chronic diseases. There's so much to do research on with respect to the individual conditions of these people who are arriving. Now, one issue, for example, that came up in the case of Turkey was that these people, once they crossed the borders, once they were in the camps, they were in fact examined whether they had immunizations that were already standardized in the Turkish case. And for children, this was a major issue. But think of a situation where people are in fact trying to cross the sea, the Aegean Sea, towards Greece, and can you stop them and tell them, do you have this immunization record with you? Do you have diabetes? So the conditions are really dire in terms of what to expect and how to address this. So the mobility issue I just addressed with these examples, and also the specific services that need to be, in fact, prioritized, or which ones will be prioritized, by which country and how so. And of course, the relocation, I just also tried to address that matter in terms of whether these people will be sent back to Turkey, whether they will stay in Europe, and if they stay in Europe, where will they stay? Will they keep moving towards the north as everybody expects them to, or will they settle in Germany? How how will they really reconstruct their lives. The social determinants of health are also there, even though they are able to find some kind of shelter in urban settings. The troubles of local communities with respect to and municipalities with respect to addressing the needs that are increasing, because people live in conditions where there are really huge numbers of people in small dwellings that try to sustain a life, even though they have shelter, is another issue. And the collaboration among which actors is the question. In the case of Turkey, as I said, because this was a disaster management strategy, there were many actors which were legitimately involved in the response, but in the case of Europe, they're still debating about whether the European Union will be responsible for part of it, whether the nation states, whether the local communities, and so on. The second, I try to address the conceptual frameworks that I raised. So instead of looking at integration policies, austerity measures, or the context itself, I'm proposing to look at whether they're able to be resilient. Now, there's a big question mark here because of the four characteristics that I have just identified. Where will the resources come from in the case of Europe, if we talk about Europe as a whole, or if we talk about the nation states individually? Which actors will matter? And in terms of resources, I also invite you to follow the debates, whether they should transfer funds now to Greece or Turkey, or both Greece and Turkey, and how much to Greece and how much to Turkey, right? So the players are there, but these players are in fact being addressed for different reasons in different ways by the EU level and by different European nation states. Which experience will be relevant? The experience we just discussed on the basis of diversity in healthcare systems which was already there with respect to the kinds of populations that they have been receiving. In the case of Italy and Greece, particularly undocumented migrants. In the case of Germany, a majority of population from Turkey. On the implementation, will there be specific services? Will there be services that are already there, which will be in fact in a way tailored towards the individual needs of these people? Will they be integrated into the system with their own capacities? Still question marks. So I think with respect to resilience, there's a lot of work to be done in terms of how Europe will respond. In terms of the transboundary crises, I just try to highlight to you that this transboundary crisis is not confined to the region where the crisis is taking place, but also a transboundary crisis that's unfolding within Europe in terms of how burden sharing will take place. Now, our European colleagues are trying to address this in terms of solidarity. That's why I had highlighted in the first quote that I have highlighted for us. Solidarity is a concept that also has its own problems with respect to how it will be interpreted, on which level, by whom, and how. And mobility-related challenges, the barriers to access, the data that's available, and the categories still ensues. No one state agrees on how they will call these individuals and which part of their legislation they will relate them to with in terms of the provision of different services, including healthcare. Last but not least, and this slide I prepared after sort of thinking about whether the last 2 weeks and the kind of changes that are taking place, and as of Saturday, they will start taking people back towards Turkey, so the movement that's itself is changing is going to take place. Number one is that this issue that is unfolding is an issue about surging in numbers, that the numbers are increasing. The slides I have shared with you are not going down at any time soon. They might be fluctuating, but they're not going any time down in soon. So the numbers and the continuous increase means that the challenge is going to increase. And I'm not talking about cost in terms of financial cost, but also qualitatively the kinds of diversification of the needs. One example is children are being born, right? On the route, in places that they're in reception centers, or in camps. So new needs are being introduced. People are aging, right? With age comes very different challenges with respect to health experience as well. The other issue is the increasing challenges to return. The conflict is not going away. So the movement itself is a symptom. There's a cause, a conflict. So unless the conflict goes away, and then there will be a different discussion about reconstruction efforts, how many people will go back, and whether they should go back, whether people should be allowed to take a decision of whether they should integrate to the societies that they have moved to, or go back. So that decision as a different decision to be taken, but the conflict itself is there. The diversifying and proliferating needs of these people. So health is not in any way, or health as a human right is in any way different from, in fact, rights in other parts of quality of life, education as part of the story, and where they live. If you consider that some of these people have been inside camps for the past 5 years, and even if the conditions are in fact promoting a life that is bearable, that is still a confined space, right? So there is a different matter here as well. And the other issue is, of course, what has been going on is in the past fall about the security dimension, meaning how do we balance the public security dimension of this mobility, the movement that has been taking place, with the right to health. So in that sense, the countries might be, I'm not saying they are, but they might be thinking about precautions in terms of the provision of healthcare services as part of their humanitarian policy, as opposed to trying to understand what kind of security challenges might be there for the people who are already present in their borders. And one of the dilemmas is how do you treat these people, who do you treat, and how do you actually remove from the minds of people this idea that they might not be there for good reasons. And the last point I would like to raise is the points that have been in fact coming forward in the past few months about solidarity around these issues. And solidarity isn't about only managing asylum, but also what comes with it: healthcare, education, different rights that will be provided to these people. And the question remains how this solidarity will unfold. As a principle, it's really important for addressing the issue, but when it comes to implementation, the debates seem to continue. But I still would like to end on a high note, a cartoon that I really have, in fact, enjoyed seeing, that no matter what happens, hopefully, in healthcare policy, and also in other policies, the idea that everyone is part of a particular challenge that they're experiencing together, and we'll remember that we're all from Earth, and this will remain as a human right rather than a challenge, a public policy challenge for nation states to determine what they will do about. Thank you. So I guess this is Q&A.
We have a little more than half an hour.
Oh, perfect. For a change, I didn't talk too much. Any questions that you might have?
I'm willing to lead.
Oh,
Well,
please do so.
which is, you mentioned over and over again what sound like really big administrative challenges in Turkey, and I don't particularly think of southeastern Turkey as a healthcare paradise even 5 years ago.
Mm-hmm.
So, in a sense, what are the knock-on effects? Like, where are they getting any practitioners? Who wants to leave Istanbul and go work in a refugee camp?
Mm-hmm. Scott, perfect question. There are already studies about this as well. Now, because in Turkey, the medical profession has an obligatory service dimension to it as well, whereby people are rotating to certain places after they receive their education. But it would be unfair to say that everyone who's in camps and serving urban refugees would be part of this. They're actually part of the medical profession and service profession that's provided. But what has been going on is, because this was a disaster situation, the medical personnel and the studies that came out, particularly by the Turkish Medical Union as Association, is suggesting that they're working overtime, and they're also addressing matters that they have not necessarily been trained for, in addition to their medical expertise. So there is a major issue in camps that we know of, that the numbers of hours that they're working and the kind of challenges that they're addressing have not been part of their training as a particular part of a medical training. Okay, so there's that issue. But then there is the other issue whereby I'm not sure if you have followed how Turkey has received the Syrians. They have received them on a compassionate basis, meaning these individuals who are arriving would be considered as guests. And in fact, I highlighted the legal framework that's available, which is called the Temporary Protection Directive. So that still is part of the particular rationale for service provision, in the sense that we're reaching out to these individuals who have been part of a humanitarian crisis, and we'll reach out in ways that we can with respect to the implementation issue. Now, this is Scott's question about how they implement their policies. But the legal framework itself has also been fairly generous in the sense that once these individuals bring their prescriptions to a pharmacy, they will be filled in, and the invoice will be sent to the Disaster Management Director General, so that they were receiving this. But now the funds are shifting. Why? Because in the past 6 months or so, the management of the particular arrival of Syrians has changed. Now there are different institutions. For example, since April 2014, there's a Director General for Migration Management, so it has its own institution. So they are registering these individuals, they're informing them about their rights in different languages and so on. So there is a shift in terms of, for example, in access to information. There is also a shift in terms of the costs that have been calculated. They were able to be operated on. They were able to have access to any kind of hospital care, in fact, at no cost. But now they're increasing the justification that's necessary for it. And also they're trying to put forward the referral system, because nationals of Turkey have to go through a referral system. But now they also will have to go through a referral system as part of the legislation. And if you're interested, I could provide you with very recent articles that have been produced in terms of the legislation or legislative changes that have been put forward in response to the challenge. That's why I put it as a puzzle, because after 5 years, the system also shows the kinds of problems that Europe might be facing if the mode is no longer disaster and emergency management mode, but the mode of healthcare provision to people who have different needs and increasing in numbers. Yes, Maria.
So from your talk, I have been getting, well, you showed us how the response has been different because of preparedness in the case of Turkey. So it has made me think of, why is it that Turkey was prepared versus Germany or Greece or Italy? I guess my first guess would be that Turkey was already prepared for other responses in the past. Like the earthquake response was a huge one in the last decade or more. So, but it can't be the only thing. What would be something else that made Turkey so much stronger?
Very interesting question, Maria. This is because I'm trying to also construct a model to understand why a middle-income country has been able to manage this much more effectively over a period of time. And also you responded to your own question in a way, because what happened is in 1999, when the disastrous earthquake has happened, Turkey has responded with the Director General for Management of Disasters and Emergencies. And what this has meant is that they have put together an institutional and legal framework and an experience, but as I said, in response to a natural disaster, right? So when the Syrian crisis had unfolded and that there was this framing of the crisis as temporary and also receiving of these individuals as guests and extending a compassionate hand to them, using this particular framework of disaster experience from before seemed to be the reasonable response. So that was also my first hypothesis to responding to this, and which was confirmed. So far, this Disaster and Emergency Management Director General had been, in fact, continuing at disaster mode. But as I explained a moment ago, what has happened is, because this has taken a longer period of time, the kind of organization, the administration that was taking place around the management of a humanitarian crisis changed. So now there are different actors involved, including the Prime Ministry, including different line ministries, right? So they're all there. So the first is, yes, they have used their experience from a natural disaster. But the second is, in response to this humanitarian crisis, for a prolonged period of time, different actors and collaboration with different actors became justifiable. Meaning, international organizations jumped in, like majorly UNHCR first, but then again, different other organizations have been present for prolonged periods of time. NGOs also have come in, right? So there has been an important proliferation of actors in the field. The third one is an unexpected explanation that I found in the field, which is the incrementalism in the situation, or trying to respond in an ad hoc manner also came up with a euphemistic characterization, its own creative ways of dealing with the crises. This means that if there were, for example, Syrians who were doctors, who were medical personnel, trying to help out to the Turkish medical personnel in times of particular crises, with maybe an epilepsy situation, etc. Not other kinds of structural problems, mental health, immunization, vaccination, but particularly challenge situations. There have been ad hoc creative solutions created for what's been going on and to address that. So these three, which was the first one was in fact expected, the disaster experience from before, but the other two as well, the reorganization of the system over time by understanding and acknowledging that this cannot be dealt with only as a disaster management strategy, but has to be expanded by including line ministries which involve all different aspects of the story, and the third one coming up with creative ones. And the second involves, of course, the proliferation of actors in the field as well. But that also will create its own problems in the future, right? In terms of duplication of efforts, making sure that funds and resources are used effectively, which actors will remain legitimate over a longer period of time, and so on. Thank you.
We've seen some pretty ugly demonstrations from the citizenry of a number of European countries throughout this crisis. And I'm wondering, because I don't recall having heard anything about Turkey, how the citizens of Turkey feel about what seems to be a pretty decent response to the crisis, which obviously involves a lot of money and personnel.
Thank you very much for this question as well. That had been also my puzzle for many years, having worked on the changes that have taken place in asylum and immigration governance in Turkey. So I'll give you the response to you by basing my rationalization of why there has not been major demonstrations in Turkey against Syrians or foreigners in general as opposed to Europe. Number one is Turkey doesn't have an extreme right party as most European countries do, meaning this issue about being pro or anti-immigration has not become a political agenda issue for a long period of time. So there's no real public opinion that had formed around the issue of foreigners or mobilizing against them. This is very much in contrast to what had been transpiring in Europe. The second issue is, until the arrival of the Syrians and the issue, the theme of coming up with asylum and migration governance, including the law on foreigners and international protection, became a technical and bureaucratic and administrative matter rather than a political matter. And this is very, in fact, surprising for those of us who study Europe, because where it is a political matter and political actors are always involved, and once the legislation came out, then the public started to pay attention to this. Now, can I say these two variables are still valid? It's very difficult. And the reason is that increasing numbers are creating two challenges in Turkey. One of them is local communities. You know, we think that countries are receiving individuals, but local communities are receiving individuals. And so far, are Syrians or foreigners who are escaping persecution and seeking refuge in another country. Now, the local community's response so far have again been fairly positive. So it's not that the media isn't reporting, it's really not there. But and the but is a big but because of what has been transpiring in the past fall, right, in terms of the security challenges that are being experienced. And of course, there's yet to be done an extensive survey on whether these will impact attitudes towards Syrians in general. But so far, your observations are correct for the reasons that I have highlighted, that it's been kept a non-political issue, that they have been received as guests and people who needed the extension of hospitality and humanitarian efforts, and of course the non-political agenda around this particular matter concerning the people who have arrived. But will that be sustained? I leave that as a question mark for all of us to observe for the future. But it's a contrast, it's a striking contrast to Europe that you have already addressed and observed. Thank you.
So you are comparing and contrasting Turkey and some European countries, and we know many neighboring countries like Lebanon and Jordan has hosted large number of refugees. We know Turkey is particular because its proximity to European Union. But what do you think Turkey's policy is right or better than other neighboring countries?
Well, it's very difficult to say Turkey's policy is right in some ways. I mean, I know Guterres has said it was correct, and that's what set me on in terms of trying to understand why this would be addressed as such. But I'm now continuing to work on the cases of Lebanon and Jordan. But what's going on is the system there seems to be, or seem to be, already experiencing challenges with respect to addressing its own population's healthcare needs. Whereas in the case of Turkey, if we were trying to compare this to the rest of the region, there has been a major transformation in the healthcare system. There has been a healthcare reform. And that healthcare reform, in fact, for better or for worse, had in place certain mechanisms that were expanded with respect to delivery of services to all nationals, which have been in fact expanded to delivery of services to Syrians as well. Now, does that hold true for Lebanon and Jordan? From the reports that I have been reading, that might not be the case. And they are experiencing higher, I mean, not in terms of numbers with respect to, well, percentage of population, I mean, those who are arriving as a percentage of population, Lebanon doesn't compare, of course, to Turkey, right? I just showed it. So there's a very big difference there. Of course, the challenges are different too. But in terms of the healthcare reform that had taken place in Turkey, it's placed in a very different position vis-a-vis the other countries that are receiving Syrians, I think. So the starting point is different than those other countries that are receiving as large numbers, but not that different from Europe, of course, which brings me to the conceptual frameworks that I'm using. Hopefully that responds to your question. Abbas has a question.
Thank you so much. This was awesome. I'm wondering, so you mentioned that the question has yet to be answered with regards to how long this is going to last and how these communities may or may not be integrated into the specific countries that they're in. Is there any indication preliminarily, because 5 years is a short period of time, but it's a significant enough time to get some preliminary indications as to will these Syrian communities, what potential do these Syrian communities have in these different cases that you mentioned? What potential do they have for acculturation or any kind of successful integration into the new countries that they're in? In the case of Turkey, is there any indication of whether or not people are learning Turkish, or So, what potential is there for that in the short or long term?
Great question, Abbas, for different reasons. One of which is, of course, healthcare policy is not itself divorced from other policies that are part of integration policies. It's just one that seems to be, in fact, put forward when there's a mass influx because there's fear of, epidemics and different kinds of whether these people are eligible or should be eligible and so on. And this question is also important for another reason, that is addressing the different debates that are taking place in Turkey in terms of addressing Syrians and other asylum seekers, all right? Now, the focus is on, of course, Syrians because of increased numbers that are arriving, but there had already been movement in the direction of Turkey and also Italy and also Greece and also Germany of other nationalities. Now, why is this important? Because in the case of Turkey, the question of integration has been put on the agenda as a result of two changes that have taken place. One is the Law on Foreigners and International Protection, which is an Article 90 that talks about integration policy, and it doesn't call it integration or acculturation or social cohesion, it calls it harmony. So there was a reason for this, harmony with the society, not assuming a dominant culture that has already been there to be abided by and so on, or to be, in fact, part of. So that was an important issue. But when that was written as a consideration of coming up with an integration policy for all involved, not particular to Syrians. Now, what happened is, in the case of Syrians, because the numbers were larger, and as you pointed out, people were staying, right, and not in confined areas. Meaning, if they were staying in camps, that would have been a different story, and only 10% of the Syrian population are in camps. The rest are in the cities, among people, walking and shopping and going to school, some of them, and so on. So that brought also on the agenda these people who are increasing in numbers and who are here and present. Do we need a separate policy for their integration? And that also opened up another box, which is, do we need Syrian-specific integration policies and integration policies in general, right? So on the one hand, since April 2013, when the legislation went through, there were efforts, and the Director General obviously has its own unit for integration, coming up with policies. There were efforts to come up with integration policies that would address a general population that were not nationals of Turkey, right? But then, when the Syrian question came up, the integration issue became a different issue. Line ministries, like the Health Ministry, had to come up with own legislation in relation to the Temporary Protection Directive to provide services to Syrians, as opposed to others who are asylum seekers and as opposed to others who are migrants. Now, why is this important? Because Turkey has a geographical limitation. What does geographical limitation mean? Turkey is a signatory to the 1951 Geneva Convention and the protocol, but it has a geographical limitation saying those who arrive from non-European countries will not be processed for their asylum applications. So they will be in fact processed by the UNHCR and so on and resettled in other countries. They will not be settled here. Now, in the case of Syrians, they fall to the geographical limitation clause, but they arrive in large numbers and they have been there for 5 years. So what did Turkey do? Came up with the Temporary Protection Directive, which gives them access to most of the rights that they would have, but also they came up with a work permit, like legislation. So now Syrians, different than other non-nationals in Turkey, will have access to the labor market in a preferential legal framework. So in fact, the presence of Syrians has accelerated and also diversified Turkey's integration policies with respect to, or the integration policy that Turkey has been trying to come up with. So that's also an important issue. We're dealing with a country which did not have in place a formal integration policy, as in contrast to the European countries that we have been discussing, Germany or Italy or Greece that have been experiencing these debates, as Lady at the back has already suggested, to think about with respect to how will the public respond, how will different political actors respond, and so on. So this has opened up a new box. Syrians, point one, Syrians versus others who are seeking asylum. What kind of rights do we provide for them? What kind of integration policies do we provide for them? And one example, not from health but education, would be, there are about 600,000 children who are between the ages of 0 and 17, and only 300,000 of them are in schooling, right? So the issue here is there is a large population that needs schooling, so now we have to address this with maybe policies that, will they be receiving Syrian curriculum? Will they be receiving language training in terms of Turkish because they're expected to live here? Or should their language rights be respected and they should have bilingual education? So there's a lot of debate in terms of providing even the right to education to these individuals, with just one slight example. But I think it's very important to put, of course, healthcare policy in perspective with different integration policies that are there, the least of which is, of course, access to labor market, and which means, in fact, directly addressing the socioeconomic determinants of health through having a legitimate income and the social security scheme, being part of the social security scheme, and so on. So, very great question.
You talked about the very messy governance challenges posed by categories. Mm-hmm. And I'm wondering, to what extent have international organizations or the EU or the individual nation states themselves tried to come to some consensus about these categories, or is it just too complicated of an issue to even have some sort of effort toward?
Bilal, let's admit, even when we're writing articles or when we're doing some academic work, it's very difficult, and I'm glad you addressed this issue, to come up with who we are talking about. So we come up with a definition first. For example, in the case of asylum seeker in Turkey, without putting this particular dimension of geographical limitation, people who are reading it or who are working on it might think, oh, aren't these people going to be processed in Turkey with respect to their asylum applications and whether they're valid and they will be processed as refugees, and so, etc. So this conflict, let's not call it conflict, but contestation around categories of these individuals is likely to remain there. And why? Let me give just one example in terms of the negotiations that have been taking place between Turkey and the EU, right? What are they saying? They're saying we're going to take one Syrian who has a legitimate claim for refugee status back and then give back another Syrian who went through borders illegally, right? Or who are undocumented or who are proven to be here not by legal means. So this means that countries, even in their negotiations, and you said you study international organizations, already reveal that the agreement over categories is seriously problematic. And in fact, one of the issues that I try to address here is that people might remain as asylum seekers for prolonged periods of time, sometimes up to 3 years, and then they might be denied refugee status and expected to leave the country, right? So then they actually switch status from one position to another over a long period of time, just waiting. And that's also a very important issue. So the categories remain fluid for different reasons. This is one that, in fact, unfolds in this particular humanitarian crisis. But also in non-crisis situations, a foreigner might be married to a national, right, waiting for 3 years to receive citizenship, but then all of a sudden in year 2 they have a divorce. So what happens? Does she or he lose the status? So, or overstaying a visa. So the categories are very fluid and they change with different mobility of people, let alone how we talk about SES and also mobility, right? Here we're talking about categories people arriving as a result of humanitarian crises, but if we zoom into the demographic profile, we are in no way talking about similar people, similar challenges, similar situations, similar means, right? Some of them might already be speaking Turkish, some of them might already be speaking another language, some of them might already be professionals in their own country. So, it's not to say that I or any other researcher would be comfortable addressing a large group of people by their national origin. We need to acknowledge that the needs, as healthcare needs, are also diversified in terms of their legal status as well. I know this has been a long and complicated answer, but our categories determine what we aim at too, but so that makes a big difference. But if we follow closely the negotiations that are taking place between Turkey and the EU in the Turkey-EU deal, that in fact reveals how tough it is to agree on how to categorize these people and which legislation we expect them to be subject to in the nation states or the EU as a whole.
Thank you so much for your talk, Sami. It was really informative. This is tangentially related to the prior two questions, and it alludes to the point you just made regarding the Turkey negotiations with the EU. For so long, the EU was claiming Turkey as an unsafe landing spot for refugees, but now all of a sudden, through the New Deal, they're magically safe again for 3 million refugees. In that regard, and also just juxtaposed against the positive sentiment of these are guests, I can't reconcile the fact that these are refugees who are being shipped from Europe back to Turkey, essentially, en masse. And so what are some of, and this perhaps is a little bit of an opinion question or opinion response on your end, what are some of the health consequences of, what do we call it, double migration perhaps, particularly as it relates to health policies, and how is Turkey dealing with the return refugees, because now they have the benefit of foresight as to the numbers that are arriving on their shores?
Mm-hmm. Ali, this is also a great question, which goes back to the question about categories and how they will be addressed once they return, right? Now, the issue is there the Temporary Protection Directive comes in handy, right? Even though they might come back to Turkey as part of the readmission agreement and as part of the last deal that's going to take place from the EU, they will still be Syrians who are escaping from persecution, right? So then, with the Temporary Protection Directive, regardless of their crossing the border towards the EU illegally, they'll still be under the Temporary Protection Directive, whereby they'll have access to rights. So that comes in handy because they will not be granted refugee status anytime soon unless the geographical limitation is lifted, and it's not going to be lifted anytime soon either. So there is that dimension of the story. Now, the second part of your question, which was actually the first part of your question, but second part of my answer, is that the deals with Turkey. Of course, in the media, we always see the money issue, right? 3 billion, 3 plus 3 billion, 3 plus 3 plus, and the 6 billion, something like that. So, but the real issue there is there are three major documents that need to be addressed. One of them is the Joint Action Plan, where both the EU and Turkey talk about what they intend to do. And a close look at that suggests that there is a lot of intention in terms of addressing the needs of these people without necessarily paying a lot of attention to their status, except they will go back to Turkey if they're admitted or if they have come to the shores of Europe with illegal means. Another one is the refugee facility. Refugee facility is very interesting. It has a consultative role that's going to be important for understanding how Turkey will approach this issue. This is supposed to be a mechanism whereby Turkey and EU will be able to sit together and discuss the priorities that will be important for them in the next years. And then the other one is, I think, the readmission agreement between Turkey and the EU, which is going to mean not only Syrians, but also others who have crossed from Turkey to Europe by illegal means will be readmitted to Turkey. So this will not be limited to Syrians only. And there your question becomes very important, because if they are not Syrians, they will probably be sent back to their country of origin, right? Because they will come back to Turkey, the safe third country. And the third part of my question, which was the opening remark of your comment and question, you probably read the Amnesty International report and Amnesty International, voices on how can Turkey be called a safe third country and so on. So that is a debate, I think, for anyone involved in terms of what constitutes a safe third country to send these individuals back to. And of course, there the issue is about discussing what constitutes imminent threat to whom, right? So there's a lot of debate among legal scholars and NGOs there, but there was also a lot of debate around the readmission agreement as well. Why? To complicate matters for you, I will bring in the issue of principle of non-refoulement, right? The principle of no return, meaning people who have a legitimate claim of escaping from persecution from one country to the other, that claim is still there. So if the claim is there, why is there a movement back to Turkey from Europe? Because the claim itself still exists, right? And then, of course, we have to go through a deeper debate on what sovereignty means and whether states can really invoke borders and whether what's going to happen to Schengen and so on. But I'll save that for other conversation, okay? So that was a complicated question which had, I think, different dimensions, but thanks for asking.
If no one's burning to ask a question, I can ask the last one.
Oh,
which
please
is,
do so, Scott.
Turkey and the European Union, it's complicated. Given decades of conversation about Turkey and European Union accession, not all of which have gone well, now how does it look to Turkish public and political opinion? Both that Turkish politics seems pretty exciting at the moment, and this European Union deal in the context of what I think a lot of people saw as Turkey moving away from EU accession. Like, what do Turks think about all this?
What do Turks think about all this? I'll say what I think about all this and then see if that resonates with the Turks in general. Now, I think, Scott, your point is extremely important for two reasons. Number one is, with what happened with the humanitarian crisis and the movement of Syrians from Turkey in the direction of Europe, because they were in Turkey for the past 4.5 years, and all of a sudden they started to move in the direction of Europe, what actually came out is that Europeans realized, oh, this issue is also our issue. It's not only Turkey's issue. And one other issue was, up until then, Turkey was saying we will be able to address these challenges and cope with the challenges that come our way by ourselves, right? And now they're saying, oh, let's negotiate with the EU to transfer funds. I invite all of you, and they're public, to look at who transferred how much to Turkey, to Jordan, to Lebanon, to countries which are being receiving refugees, and when. Right? And when you look at the UNHCR documents and so on, or resilience plans, Turkey had not been receiving much. They have been, in fact, spending from their own resources. So now the whole issue became an issue about Europe and now an issue about Turkey's and EU's accession. Now, there had been, in the past few years, much disinterest in EU membership, justified for very different reasons. The European Union itself is in crisis, Greece itself is in crisis. This has been a process that has been taking too long, and so on. But the kind of negotiations that are now taking place, it's all a matter of framing and perceptions. That's why I said, can I tell what all Turks think? But what I think is that this has been framed in such a way that the EU accession process, and that's why Scott's question is very important, and how to have a deal with the European Union, or how to have a deal between Turkey and the European Union to cope with the humanitarian crisis, have been mixed. Whereas these are actually two different matters. On the one hand, there is a humanitarian crisis as a result of which there's mass influx of people, whereby Turkey and the EU are both having to address the challenges that are transpiring as a result of this humanitarian crisis. And then there is the Turkey-EU accession. But what happened is, in the deal, all of a sudden, there had been two emerging dimensions to the Turkey-EU accession process. Once, the Turkish politicians turned around and said to the public, as a result of the deal, we will open further chapters. I mean, if you studied accession processes, you will know. Opening chapters means you're going to proceed towards your accession and membership. And second, we will have visa liberalization with the EU, which means that Turks will just take their passports and will not have to apply for visas and will be able to travel freely within the European Union. So these two, one, concrete steps towards accession, two, free travel for Turkish citizens in the European Union, as a result of Turkey applying the EU-Turkey deal on the humanitarian crisis, have been packaged and presented together. Then, of course, public opinion would be positive towards this. Why? Because there is a give and take as a result of the deal. But, and the but is on this side of the issue, a humanitarian crisis which requires attention on the basis of addressing the rights of these individuals who had been suffering, as opposed to an accession process which had been going on for a long time. Can these two be really linked? And whether the performance in one could be part of the other. Now, the response to this would be yes and no. Yes, because of political reasons of promoting Turkey's accession to the EU, this would be maybe an opportunity. But the no is, this is an issue that actually requires particular attention to be paid in terms of resolving of the conflict and making sure that these people are safe and have a quality of life that they can look into the future with respect to having dignity, having respect for their human dignity wherever they are, any European country or Turkey or Jordan or Lebanon. And on the other hand, there is the issue of prolonged Turkey's accession to the EU. Now, one word of caution here is, accession process doesn't have a criteria for other countries of how do you deal with a humanitarian crisis. If you deal with it well, wonderful, proceed toward accession, right? So there is also that other dimension to this where it wasn't a criteria at all in the overall process. But one thing I would like to add to our discussion is, the EU came up, and that's the fourth document to look into, with what's called a humanitarian admission scheme. That is, with readmission, they'll take back the people, Turkey will take back the people who have entered illegally to the EU, but with the humanitarian admission scheme, the EU actually promised, and this skips most of the people who are looking at the issue, the EU actually promises that they will take in Syrians from Turkey once they identify them as people who are escaping persecution. And this has been put on the agenda very hastily afterwards and so on. But this was Turkey's way of making sure that the movement would have some control over it with a legal basis. But I think mixing these two, no matter how the results will turn out for either Turkey or the EU, is not necessarily the best move toward Turkey's accession to the EU or respecting the rights of the individuals who are in Turkey for very different reasons.
And on that cheerful note, can we all thank Saima?
Thank you so much.